And here to answer your questions in our Ask the Doc segment is Dr. Msonthi Levine. So as far as asking your patients those tough questions, are you already talking to them about it?
I've been doing it since actually I started practice, but that's kind of what I do as a primary care physician. You know, if you're an orthopedist or a spine surgeon, maybe that's not something that you're going to do on a regular basis. So primarily, primary care physicians, it's their responsibility to initiate that conversation, certainly lead by example. You know, the physician himself or herself has to be healthy as well and project health. That's sometimes difficult for us. We're people too. You know, we have complicated lifestyles as well. It's difficult to turn down Cheetos when you're hungry and when you're stressed out.
Good right now.
That's right. But I've been doing it for a long time. You know, it's difficult out there. The people are having a hard time figuring out how to do it. The access to healthy food is limited. The access to unhealthy food is easier. People are on a budget out there. They're working late hours, so those types of foods are easily accessible. And then where to fit in exercise, how to do it. A lot of people are not really physically tuned into that. They have to figure out how to do it, where to go. A lot of misinformation out there. So I just kind of keep grinding with my patients every time they come, just to keep reminding them, more specifically, telling them what we would like exercising 20 minutes 5 days a week, trying to get in 5 servings of fruits and vegetables, trying to just simplify it so they can take something home with them and then grow on that. Nobody does
we grind it out here every Monday, so I just didn't know if you were grinding it out in your office too.
I mean, I think it's important for doctors to bring it up. I think if they go to their doctor's office, primary care physician, like I say, and it's not mentioned, then it must not be important. So why do it? So just mentioning it a lot of times just set something in their mind that it might be important because it is. Physical activity, eating healthy, you just cannot get away from it. If you want to be healthy as you get older, you must invest time into doing that. There's no way around it.
And there are so many things that are making it easier, such as apps on your cell phone to kind of fit it into your schedule so it's a little bit easier to time manage.
Absolutely, to track all those things, the calories per se, to figure out how to exercise quickly. The apps do count, but unfortunately there is no app to prevent you from eating that burger and fries, eating the fried chicken, not eating the green beans and vegetables, and drinking water versus drinking a sugary beverage. So it comes down to just making that decision that your health is important.
All right, on to some of our viewers' medical questions. This person says, I just had a baby 6 months ago, and for the past 2 months I've been losing my hair by the handfuls constantly. What could be the reason?
The pregnancy itself, that's very common. Doesn't happen in every person, but it does happen often enough. The hair should grow back in several months. The hair follicle is not destroyed. It's just a hormonal situation. We don't have to put them on hormones. 100% of the time, the hair typically comes back.
Okay. This person, what are some of the causes of urticaria? Urticaria. I've already been to an allergist and I have no allergies.
Yeah, it's basically hives. A lot of different causes actually. Temperature, stress, food. A lot of times we don't know. Our skin is in contact with so many different things every single day. All the environments we're indoors a lot of man-made material. Our skin may interact with that. A lot of times we just treat it with antihistamines such as Claritin, Allegra, Benadryl, or even Singulair.
Okay. Can I go 42 weeks in my pregnancy?
Typically not. They normally like to induce about the 41-week time. There's nothing that, there's no benefit to go beyond 42 weeks. The fetus should be fully developed, so they typically will induce a pregnancy.
All right, and we've got lots of other questions. We'll get to those in just a minute, so don't go away. Dr. Levine will answer more of your questions next on Live at 5. Well, we're back to answer more of your medical questions. This viewer writes, their left ear and jaw hurts when their mouth is open too wide. What could it be?
Probably the jaw joint at that point, the TMJ, that's where it connects to the skull. It can develop arthritis, so probably related to that. Maybe not try and open the mouth as wide, or try an anti-inflammatory medication, or maybe even a topical anti-inflammatory gel such as Voltaren.
Okay. The lower back pain shoots down the right leg into the foot, which is numb. What could that be?
Probably what we call radiculopathy, a pinched nerve from degenerative joint disease of the back. Very common problem related to a lot of our risk factors here in America, being overweight, sedentary lifestyle, smoking. So a lot of times we treat that with anti-inflammatory medications, injections, sometimes topical patches.
So you don't have to have surgery for that necessarily?
Typically not, but sometimes you do. I would say less than a third. We try a non-surgical approach because sometimes surgery can create more back pain after the surgery from scar tissue and healing. So it's typically treated non-surgically.
Okay. This person has varicose veins in their leg. They itch and they hurt. Would scratching and rubbing it cause blood clots?
No, but I would be concerned about maybe a cellulitis or bacterial infection of the skin. Anytime you traumatize the skin and there's issues with circulation, such as varicose veins, it sets up shop for an infection. It can be very serious, red, hot, swollen, painful, so that would be my top concern.
Okay, this person has had joint pain for the past month. The doctor has said it's not rheumatoid arthritis or gout. What else could it possibly be?
It could just be osteoarthritis, more common, could be lupus. Sometimes it takes time to fully develop those issues. Sometimes you need more blood work in the future. We normally start off with anti-inflammatories, Mobic, Celebrex, etc. I think they've had a good evaluation, but keep going to your doctor because other symptoms may arise. You might get a rash, you might get anemia. Those are signs of other illnesses that can cause joint pain.
Okay. A 100-year-old woman is seeing things that
God bless
aren't
her.
really there. Exactly. Congratulations. But her
Yes.
mind is otherwise sharp. What could be causing that?
Yeah, but if you're seeing things that are not there, that's not so good either. We call those hallucinations. Can typically be treated with medication. However, if they're not that bad, I might just watch it because the medicines can be very potent and can cause side effects.
Especially at 100.
Especially at 100. I try not to medicate 100-year-olds if I can help it, so I would probably watch it if it wasn't too bad.
Okay. This person says their 8-year-old daughter has 2 lumps behind her right ear, and they're causing her a lot of pain. One is right behind the ear. The other is 2 inches or so from the other one and is larger than a marble. So far, they have no answers.
Anytime it's large, something like that, we biopsy it. That is just a simple solution, or get an x-ray, but biopsy is the definitive answer typically to that. We can look at it under the microscope and determine what it is or it's not.
Okay. When you have an infection in a tooth, how long should the mouth stay swollen? I went to the ER last Thursday, and they gave me a shot for pain and the antibiotics, but every time the swelling starts going down, if I talk, then it starts swelling back up.
Just seems like it's not resolved. Sometimes you need surgery. Antibiotics normally we start off with, but if the infection is large and involves a large amount of the mouth, then it sometimes needs surgery, your teeth pulled. So if it's not going away, get to your local dentist or oral surgeon for definitive therapy.
All right. And that's all the time we have.
All right.
Unfortunately, we appreciate your time, Dr.
Yes, ma'am.
Levine, and you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen. Fax us 892-7305. Email us at laf@kfdm.com or post those questions every Monday on our KFDM News Facebook page.